Hello, and welcome to this learning module on fevers in infants and children older than 3 months. This presentation was created by Cornerstone Pediatrics. The information on this site is available to you solely for general information purposes. Information on the site is not intended to diagnose or treat any illness. You should talk to your healthcare provider about how information on this site applies to your health conditions. We'll go over the following questions today. What is a fever? How does it affect young children? How can I help my child feel better? What do I need to look out for? A fever is any temperature over 99.0 degrees Fahrenheit when taken under the armpit, or over 100.4 degrees Fahrenheit when taken rectally or temporally. It may be a signal that the child's immune system may be fighting an illness or an infection. Fevers in young children can cause flushed cheeks, fussiness, babies and children to be more tired. They can dehydrate more easily. They can have poor feeding, faster breathing, shivering, or sweating. How can I help my child feel better? A lukewarm bath may reduce fever. Do not give acetaminophen to infants less than 3 months or ibuprofen to infants less than 6 months unless your baby's healthcare provider tells you to. For infants less than 3 months, the baby needs to be evaluated by a healthcare provider in the emergency room. Offer more frequent feedings to encourage hydration. When do I need to contact my medical provider? If there is a fever greater than 102 degrees Fahrenheit in an infant 3 to 12 months old, if there is a fever greater than 102 degrees Fahrenheit for more than 2 days in children less than 2 years old, if there is a fever greater than 102 degrees Fahrenheit for more than 3 days in children over 2 years old, if you see any signs of lethargy, severe vomiting, trouble breathing, dehydration, stiff neck, or no clear source of infection, you'll need to contact your medical provider. Thank you for learning about fevers in infants and children older than 3 months old. For medical questions, please call your provider. If you are experiencing a medical emergency, please dial 911 immediately. Do not rely on this information as a substitute for professional medical advice. Thank you for learning with Cornerstone Medical Group.